keeping the heartbeat of the city healthy with health tips and benefits from real doctors in the area. This is Health Help.
Welcome to Health Help. I'm Jim Perkins with Wellmont Diabetes Treatment Center, and today we're going to talk about something that is a growing problem in our country and specifically in our region, and that is the number of folks that are on our roadways that have diabetes that may experience a high or a low blood sugar event. Before we start, I'd like for you to watch this clip.
So, what's a window sticker have to do with diabetes? Tennessee law enforcement and emergency personnel have been trained to recognize this sticker to identify individuals who may be having a diabetic emergency. If you've been diagnosed with type 1 or type 2 diabetes, request a prescription for the Diabetes Alert sticker from your medical provider. For more information on this free alert program, call Wellmont Nurse Connection or visit mydiabetesalert.com.
That about says it all. What does a sticker have to do with diabetes? Today's day and time, we're seeing more and more and more individuals that have diabetes. It just goes to say, with that increased number of people with diabetes, more and more are going to be driving with the disease. When you drive with diabetes, you run the risk of having a high blood sugar, which is hyperglycemia, or a low blood sugar, hypoglycemia event. These events create the same thing that law enforcement sees in impaired driving with either drugs or alcohol. So we developed a sticker, and this sticker goes on the back window of a car that alerts the law enforcement, the individual driving this car has diabetes. That might be the reason for the erratic driving, someone slumped over the wheel of their car in the evening, or an accident. This gives law enforcement a heads up. Sometimes that very few minutes treating someone with diabetes could be life-saving. So that's what we want to talk about. This sticker was developed at Wellmont's Diabetes Treatment Center several years ago, and we worked with local law enforcement to make this happen. We asked law enforcement, do you see this happening in our area, because we know it's happening in the country? And the answer was a resounding yes. The first story I heard was in Hawkins County. The law enforcement was chasing someone going the wrong way on 11W, and when they pulled them over, they were probably a little agitated. One of the law officers noticed there was something not quite right about this individual, and it was ascertained that they were having a diabetic event. That was just the tip of the iceberg. More and more and more stories came out on that. We had the opportunity several years ago to go to the Chiefs of Police annual meeting in Nashville, and every one of the chiefs wanted to talk about instances that happened when they were officers or what they see now in the roadways in their particular city. So this sticker was developed to give these law enforcement officers a heads up. We decided that we were going to do a card, and that card at one point in time was carried by every law enforcement officer in our region as well as the highway patrol in the state. And it said, hyperglycemia and hypoglycemia, these are the signs and symptoms. And they could then ascertain if this individual was truly impaired or if they were having a diabetic event. Now, signs and symptoms of hypoglycemia: shaky, nervous, sweaty, dizzy, confused, fast heart rate, you're hungry, you're sleepy. Does that sound like impaired driving? It does to me. Hyperglycemia is high blood sugar, and some of the signs and symptoms are a fruity breath, and that fruity breath really does remind you of alcohol breath. Drowsiness, difficulty waking up, confusion, blurred vision, unstable on your feet. All these things, when we took these signs and symptoms to local law enforcement, they said, this mimics exactly what we see in impaired driving. So we developed the card. Now, we didn't stop here. We started that program here in the Tri-City area and went to the state of Tennessee, and they gave us a grant. And with that grant, we have taken this across the state. So you now see it in 26 different hospitals and regions, from the Tri-Cities all the way to Memphis, Knoxville, Nashville, Chattanooga, and small towns in between. This particular sticker has saved lives, and it's given law enforcement a heads up to say it might be something else other than impaired driving. To get this sticker, you have to have a prescription from your physician that says you have diabetes. We have those readily available at our center that you can take to your physician, or you can go online at www.mydiabetesalert.com and download that sticker. You can also see what parts of the state have the Diabetes Alert sticker. This is Jim Perkins, Talking Diabetes.